Imagine being a brand new nurse, still learning new skills, when suddenly you find yourself working during a pandemic. That is exactly what happened to Matthew Saunders. But guess what? He immediately stepped up to be first on the front lines.
I'm young, I'm healthy, and I figured if anybody wanted to do it, I wanted that to be me.
ICU nurse Matthew Saunders volunteered to care for the first COVID-19 patients at Sharp Grossmont Hospital.
I wanted the experience of it. I knew it was something that was going to be coming in the future, and I wanted to be kind of the forefront of it for our unit.
Just 6 months out of nursing school, Matt says he welcomes this steep learning curve.
Being new, I'm getting a lot of exposure really quick. As the patients get more critical throughout their stay, I'm getting to follow along the process and learn a lot along the way.
Developing essential skills while caring for the sickest coronavirus patients.
The specialty beds that we have for them that turn them prone onto their face so they can get better oxygenation and things.
Do you worry about your own health?
No, we have the equipment to protect us. So actually it's nice knowing that you are caring for somebody that actually does have the virus because you take the proper precautions. I think it's a lot scarier to go to a grocery store or out in public because you really don't know who does or who doesn't have it, and not usually as well protected.
Which is also why Matt and his fiancée decided, after much discussion, it wasn't necessary to live apart.
As long as you're wearing a mask and you're not touching your face, you're really conscious about washing your hands, we figure the risk is low.
Matt has the type of quiet confidence that's pretty incredible for a brand new nurse, and this is the likely reason.
I was a sergeant.
He has life experience on a different kind of front line, serving as a reconnaissance Marine.
I was with 1st Recon up in Pendleton.
Deployed once to Afghanistan, Matt believes his years of military training have helped him become a better nurse, able to focus on patient care and drown out distractions like restrictive PPE.
Wearing a gown is like wearing a trash bag. You get, you sweat under it. It doesn't breathe. And wearing a mask isn't comfortable. I was thinking, I don't really notice it a whole lot, and I think I link that back to the military.
Matt is grateful to be working at Sharp Grossmont.
Everybody there is doing really great work.
It's the same hospital where he was born and where he just spent a milestone birthday on the job.
I was born at 6/15, and it's like, okay, 30 years ago I was born here. And I think it was interesting. It kind of came all the way around.
He also plans to circle back to military life, helping save lives as a flight nurse in the Air Force Reserve.
Let's say a guy gets wounded in Afghanistan and they need further care, so they'll have nurses and doctors and things on board to get them to where they need to go. And that's hopefully where I would be.
He'll be caring for those who serve, really following in the footsteps of Florence Nightingale as we celebrate her 200th birthday today, marking International Nurses Day. That wraps up our Nurses Week series. We hope you enjoyed the stories. You can find all 7 of them at CBS8.com.